First question that we're going to look at this evening is about access to adequate mental health workforce in Ankeny and in Iowa. We're at the bottom of the rung when it comes to having adequate mental health workforce here in Iowa. We are now the third fastest growing city in the nation. And not only is it difficult to find access, the other statistic I'd like to share with you is the average wait time to see a psychiatrist or a psychologist is 47 days. Now we know that 1 in 5 Iowans suffer from mental illness or substance abuse disorder. We are graduating new psychiatrists and psychologists every year at the University of Iowa. Not one of the psychologists that graduated this year stayed in Iowa, took up a residency in Iowa. Why? Because the reimbursement rate, the money, is so low. We have the lowest reimbursement rate for providers of mental health care in the nation. That the job itself is so demanding, and it's hard to maintain that workforce because many of those providers end up in a burnout situation after 10, 15, 20 years in practice. How do we get young people who are graduating from our university to stay here in Iowa and provide services to folks in Iowa? Would be a state-funded education loan forgiveness program that would require a commitment for that person to stay in Iowa for a set number of years. One thing is for sure, we must stand up for adequate access to mental health care. The consequences of not addressing this issue is too tragic for our community and for our state.
Will you work with this event's sponsoring organizations to craft and introduce legislation to create and fund a loan forgiveness program for providers of mental health care?
Yes, I would support that. Thanks. Polk County runs a $7 million deficit every year just to provide the existing services that we are contractually obligated to provide. And the legislature isn't currently following existing law with the levy that was frozen 20 years ago. They're supposed to provide equalization funds. Oh, sorry, my time's up.
It would be my pleasure to try to find new mechanisms to support, to keep people here. I noticed in the December 2014 report, 700,000 mental health and disability professionals needed across the country in the next 10 years. We've got our work cut out for us. Thank you.
Well, I would absolutely support a loan forgiveness program, and I just want to add to that, my husband is a family doctor at Broadbones, so these are the sort of issues that we talk about all the time, including mental health in general. But I also understand that medical students, when they are thinking about what specialties they want to go into, they're often thinking about what that pay is going to be because they are going to have a huge amount of debt. And so, unfortunately, primary care and psychiatry are at the bottom of the barrel when it comes to pay, and of course reimbursement rates, which were mentioned before. So if we actually want psychiatrists here, we need to be willing to pay them.
The fourth, yes, absolute yes to the question about loan forgiveness. I've already supported that for doctors, but it's a very limited program in terms of the number of new doctors per year. There's 2 years in one program, 5 in another. Those exist. It does include psychiatric nurses, LISW social workers, and other folks in the mental health field. But it's a good start and a good way for a $200,000 cap on an investment return to these professionals.
Counties need local control for health funding. Will you co-sponsor legislation which will grant ongoing authority to counties to adjust the per capita tax levy for mental health to as much as $47.28 per capita? I'll hear from Representative Landon first.
The bill stalled in the Senate. It was not brought out last year. It seemed like a good compromise effort, and you can see that it did not move. We need to find a new solution. I think that Iowa is one of 3 states relying on property taxes for mental health. I think it's coincidental, but certainly can't escape us that if there's 47 states not relying on property taxes and we're 47th in providing services, shouldn't we be taking a look at this issue and really trying to solve this in a meaningful way?
Thank you. Is that a yes? Then you will support it?
I'll
Okay.
find a way to solve that.
The second question is, will you arrange a meeting with your party caucus leadership and the sponsors of this event to discuss the mental health tax levy?
Yes, that's very easily done, and I know that leadership is always happy to meet with any group or with us helping with that group, so I'm very happy to do that.
Thank you. Thank you.
So yes, absolutely. I support increasing cap on the levy, and I think it's we have short and long-term solutions for mental health care in this state. This is a very immediate way to help, so I strongly support it. And I just want to add the increase, at least in Polk County, when you're looking at what those property tax dollars are, it is $17 per $100,000 house. So if you're thinking about what that would mean for you, I mean, let's be honest. It's like going out to dinner one night of the year with your whole family. We can do it.
Would you like to answer? Will you arrange a meeting with your party caucus leadership and the sponsors of the event to discuss the mental health tax levy?
Absolutely.
Thank
I think that's just an amazing answer.
Thank you.
Absolutely, yes. I will co-sponsor the 4728 at the county level. It is needed. I believe in local control. As a school person, that was something I fought hard on in education. On this issue, I chair the local government committee. Cities and counties are basically what are related to that function. Counties want this. The regard is the property tax ceiling, and something that I'll try to touch on in my closing remarks on the fund balance in other regions that causes the problem to allow most Iowa legislators.
Will you arrange a meeting with your party caucus to talk about the tax levy?
Well, like my friend Heather, I sat down before this. Like my friend Heather, I'm going to say absolutely yes. Arranging the meeting, as has already been stated by Representative Landon, is something that we can commit to. Not everybody on the planet that wants to go into a small room and meet with caucus leadership should be a part of that. But this group should have an Ankeny delegation with its expertise, and we will get that set up.
Yes, I agree with my fellow candidates here that I would fully support the levy. And if I may, I would also support the meeting and be happy to arrange that. Thank you.
Thank you.
When you think about 1 in 5 people, or if you're just looking at the number of people with serious mental illness, which is 4.5% of the population, or about 127,000 people, think about it. Less than 123 psychiatrists, actually less than 300 prescribers overall available in the state. And when you're only looking at severely mentally ill, I mean, that's not including everybody else that wants to get in to see them too. And look, I've been in the mental health advocacy business for a long, long time, and we have been waiting for a long, long time for some real leadership in the state legislature. So that's basically what we are asking you to do. So for your final question tonight, will you be a champion for us? Will you agree to be a member, perhaps a leader, of the Mental Health Caucus in the Iowa legislature?
Well, I absolutely will. I think the Mental Health Caucus is a fantastic idea, and I'd be really happy to take any kind of leadership role that I could take on it. And I also just wanted to add that I think mental health is by far one of the most pressing human services challenges we have in this state right now. And I will tell you, as I've been door knocking all across this district, it is something that I talk about at virtually every door. It is something that is brought up to me before I even get a chance to mention it. So I look forward to the opportunity to work on this issue as much as humanly possible, should I be elected this year. Thank you.
I've been asked about the Mental Health Caucus to serve on that. I'm happy to do that. I've served on Successful Families Caucus, which is also bicameral, bipartisan, meaning multiple members from Senate, R&D, same with the House, and was in leadership in that. I believe that's a good process. It was well described by Teresa who's done some good background on this. It's an excellent question for this group to have placed in the concept of how to move this forward, get more legislators and state experts talking.
I would be very pleased to be a part of the caucus. I think bipartisan caucuses are really the way to move forward. Right now, partisanship is what's causing a lot of gridlock down at the State House, and I think bipartisan caucuses are the way to help move forward some of the critical issues like this.
Well, it'd be my pleasure to join a caucus to work on mental health reform and mental health funding issues. I have great respect for Teresa Baumhoff and the work that she does here in Ankeny, and I look forward to working with any groups, any people, any constituents at any time on this issue to try and move this forward.
First, I'm asking you all, will you meet with the sponsors of this event to discuss mental health care issues within 30 days of taking office?
Yes, I will, and in fact, as soon as I met Peggy Huckert, we became Facebook Friends leader from NAMI. As soon as I met her, I instantly messaged her and asked her for a briefing. So it's an issue that, of course, I'm ready to act on as soon as I can.
Great, thank you. Thank you. Representative Landon.
Sure. Yes.
And Representative Phillips. It was Bethany.
Yes, absolutely.
Great, okay, well, I'm going to give you each one.
Well, I am impressed with the preparation for this famous AMOS start. I want to congratulate you on a great turnout and an excellent opportunity to improve community awareness. I'm also very committed to this issue, much mental health in our own family and in my own experience. I'd like to touch on that, but there isn't time. We heard amazing stories from Steve, from Father Steve, and from Melissa. We know we can do better. I would like to present a little bit of information about what is in place. Polk County Health Services is the mental health entity overseeing much of what happens in service in our mental health region, one of 15. The exec director cares enough to be here tonight. And there are 47 services listed that are provided through that agency to reach our folks. There are some very caring professionals in how these services reach folks. That has been well documented. I'm going to quote Melissa because I'm allowed to quote her, maybe not other people, but quote her. We can do better. Folks know a way to do better. Funding is part of the answer, it's not the whole answer. In this very building, there are very many examples of communities stepping up, looking at identified needs and finding ways to address those needs. That's how we serve community. But these are very complicated issues. In our own family life, we raised 3 kids that were all very abnormal. The middle one was the one that was noticeably so with her physical disability. She was a Marta Dimes poster child. But Erin, although paralyzed from the waist down, everybody loved her. She was easy to look at. This stigma stuff that comes around this is very painful for many of our families. It's very painful to sort out the answers. I'm very happy to be amongst every leader on this panel that is committed to listen to you and others on solutions.
I prefer what you said last time, Representative Phillips. You know, when Peggy sat down to meet with me, she said, nobody brings you a casserole when somebody in your family is diagnosed with a mental illness. So the stigma involved with mental illness is one of the biggest barriers that we have to really reshaping and restructuring the system that we have in place. So I want to thank the leaders and the citizens who put this group together. When I relocated here with my family to raise my kids here in Iowa, everybody said, you're going to love Iowa. I'm originally from Idaho. Iowa. Everybody who's not from here thinks they're the same place anyway, right? But we were told, you're going to love Iowa. It's great. The people are nice. It's got a great quality of life. But I think what's been happening with funding over the past couple of years and a lot of critical issues like this, we're slipping. As you heard earlier, 47th, 46th, 50th. And that's not acceptable. In order to have a good quality of life, you have to have people who are healthy in body and mind. So this is a critical issue that can't go another day without being addressed. So I thank you all for coming tonight and showing that you're prepared to help us work on this. Thank you.
Thank you. I would like to applaud all of you for being here tonight because this is a local issue that we can deal with in Ankeny. It's an issue that we can talk about at the county level, and it's an issue that we can talk about at the state level. And as we move up those levels, it gets more and more complicated because we try and do the same thing for 99 counties and treat everybody the same. And it is virtually impossible to do it, as you can witness by the lack of progress that we've been able to make in the legislature in the short period of time that I've been there. I pledge to you that I will do all that I can in my utmost to try and resolve that gridlock and move that issue forward, work with the Senate, work with the House to get this finally accomplished so that Polk County can move on and provide the services in a meaningful way for each one of you. I've so appreciated the stories. As I look across the audience, I can see that most of you have stories to talk about. And I think it's very important that we hear those and understand those and respond to those. Thank you very much.
Thank you. And I just wanted to give a huge thank you to everyone who's here tonight and for taking your time to come out and listen and share the stories. And it took everything in my power not to cry, sir, when you spoke, and also when you spoke. It was amazing, and say amazing, that makes it sound like it's good. Just powerful, and I'm so grateful that you chose to share with everyone in the room, because I imagine that was difficult. You know, I'm running because I believe it's time for a new generation of leadership, but also because I think voters deserve a much more open and honest conversation about the challenges and the opportunities that we have in this state right now. I have already said that I believe mental health is one of the most pressing human services challenges that we have, and I think if we want to do things differently, then maybe we need to elect some new people who are willing to shake things up a little bit and push the envelope on these issues to make something good happen in our state. Closing the mental health facilities in the last year was a huge way to exacerbate the problem when it came to beds, which is part of why we're now 50th in the nation. I think that was a bad decision, and I think it's unfortunate that some people chose to go along with the governor on that. I would not have made that choice, and I will work, should I be elected, to provide support in local communities so that people can get care close to home and fight for the funding that we need, that counties need to actually provide adequate services for our people. So I thank you so much for your time. Thank you for listening. Thank you for sharing. And I ask for your vote on November 8th if you live in District 38. Thank you so much.
Don't forget Christy in the back. She's at the back of the table, and that table back there with her flag outfit on.